Hi, Chow. Great to check in with you today. I have a client that I wanted to have a chat about who has had an initial assessment with me, including the WACE intelligence testing and self-report symptom-based measure diamond. My client's name is Sam. He's a 26-year-old male presenting with cognitive difficulties and social anxiety. He's found it difficult to perform at work, finding it challenging to complete tasks, and especially when put on the spot to answer questions or make decisions. He often worries about not having anything interesting to say or saying the wrong thing in social interactions in fear of offending his friends. Sam has specifically mentioned that he feels that he can't be, himself around his friends for that particular reason. Sam's currently unemployed and really struggling to apply for jobs. His anxiety is affecting his social, occupational, and overall well-being, which is really making it difficult for him to focus on everyday tasks. So, as you can see, Sam's really having a difficult time right now. Sam's symptoms are characteristic of social anxiety disorder, and learnings from cognitive models of SAD suggest that there are certain maladaptive cognitive processes at play. Appraisals of risk and coping can be distorted with negative beliefs about oneself and others in social interactions. And this often provokes fear and anxiety that is out of proportion to the actual threat of the social situation. For Sam, this presents as attention difficulties and heightened feelings of anxiety, fear, and worry in his interaction with others. Sam's thoughts, beliefs, and assumptions seem to be playing a significant role in the progression and maintenance of his social anxiety. Likewise, efforts to reduce Sam's social anxiety may be realised with changes to dysfunctional beliefs about self and others in social situations. Long-term, the goal for Sam, with the aid of cognitive behavioural therapy, is for him to recognise and change his maladaptive patterns of cognition and behaviour and develop more adaptive ways of thinking. Core CBT tools such as cognitive restructuring, exposure therapy, social skills training, and relaxation techniques will go a long way to help him with his anxiety. Just going to pause there to see if there's any, long-term goals or that you think that I should be considering for Sam that's different to what I've just presented. Thank you. That's great. Moving on to my short-term goal for the next session with Sam is really around focusing on psychoeducation. It's important for Sam to understand his social anxiety, the challenges it presents, treatment options, and prognosis. I think this will help him feel more empowered and enhance the therapeutic process. Just going to stop here as well and just ask if you're comfortable with the short-term objective for the next session, or is there something else that you think I should be considering? Excellent. So moving on to talk about CBT. CBT is really a structured and practical therapeutic approach to challenging negative cognitive process that will help Sam manage his anxiety by teaching him more adaptive ways of thinking and behaving. As I've mentioned before, tools like cognitive restructuring, I can actually work with Sam to identify his negative thoughts before they occur, during and after situations, to evaluate the accuracy of his thoughts and consider other possible explanations. Similarly, with exposure therapy, Sam and I can work together to identify and rank order a list of anxiety-provoking situations and work through the list with either role play or by confronting feared situations from least to increasingly more difficult. Relaxation training as well will help Sam to learn to attend to and control his physiological responses during or in anticipation of the situation. Meta-analyses and reviews of CBT outcome studies have proven CBT to be an effective treatment for a wide range of conditions and really the gold standard when it comes to treating anxiety disorders. In a comprehensive review of the treatment outcomes of 16 meta-analyses, CBT was found to be effective for many mental illnesses, and similarly, CBT was found to be effective in a study examining the efficacy of CBT across anxiety disorders. Pausing there again just to check in and see if you're comfortable whether this is the right approach. Awesome, thank you. A few things I've noted on the possible process issues to be mindful of. Firstly, Sam's problems with concentration and focus and how this may impact his ability to complete homework tasks between sessions, because that is really a key component of CBT. Sam's anxiety with social and performance interactions may make him resistant to treatment, especially when confronting deep-laid perceptions of self and others in social situations. Couple of things for me to think about. First one is being critical. It's important to build that rapport and trust with Sam. Collaborative empiricism is a key clinical factor in CBT and a major determinant in the success of therapy. A lack of trust and rapport can really impede the progress. And finally, as a less experienced clinician, potentially I'm prone to fear of making mistakes, like choosing the wrong interventions or making errors in judgment, or even meeting Sam's expectations, and this could all disrupt the therapeutic process. Pausing here again just to see if there's anything else here that I should consider. Great, thanks. Finally, for the next session with Sam and my step-by-step plan, the first thing I plan to do is do a mood check with him on a 0 to 10 scale. Opportunities here to get an update from Sam around how he's feeling and to check about other related problems, sleep, diet, etc. Secondly, I want to do a walkthrough up front with Sam about the agenda so that he knows what to expect. This will cover 3 things. The first one being an understanding of what therapy involves and how it'll work. For example, explaining CBT framework and clarifying roles, information about his condition and how negative thoughts, feelings, and behaviour can contribute to his anxiety, and then facts on the CBT model, the role, core beliefs, dysfunctional assumptions, and negative thoughts can have on his anxiety. I'll use this here also to introduce core CBT tools he will learn to challenge his way of thinking and behaving, including the role and importance of homework and discussing resistance. At the end of the session, there'll be an opportunity for Sam to provide feedback or ask any final questions. I'll also share with Sam some resources for his information to read about CBT and social anxiety in his own time for homework. Does this sound like a sound approach for you? Are you confident that I've got a solid plan here of what I plan to work through with Sam in the next session? Excellent. Look, thank you so much for your input. This has been really helpful.